Thanks to the internet, I am now known as the professor. So we're going to do a basic guide to the female anatomy. If this landed on the wrong FYP, please send it to a gentleman who needs to know this. Immediately on the outside, we are going to have the vulva. This is not the vagina. The vagina is the canal on the inside. This area is defined by the presence of two sets of lips, the labia majora and the labia minora, which just means big lips and little lips, because labia means lips, and you have facial labia and labial creases on your head. If you were to spread these lips open, you will find at least the partial structure of the clitoris on the inside. But the entirety of this structure actually looks something like that and would be placed approximately there. In between the eyes here, just below, is going to be the P2, or the urethra. This is where urine and also squirt, because squirt is urine, comes out of. If you were to look uncomfortably close on either side of the urethra, you would find the paraurethral glands, or the Skene's glands. This is the site of female ejaculations. Yes, squirt and female ejaculation are two different things. They often happen at the same time. This is part of why it is so confusing for so many. Okay, so far we've got the clitoris, the paraurethral glands, and the urethra. Below all of those things, we have finally arrived at the actual vagina. There is one more hole on the outside. That would be the forbidden Cheerio, the anus, the fudge factory, and no matter what your buddies say, this motion is not popular with most people. Please do not default to this ever. I do want to show you a view that you don't get to see very often. This is actually what the uterus looks like when it is in position. It is not all splayed out like a lot of people think. The ovaries tend to sit actually kind of behind it. But this is going to be the uterus. These are the ovaries, and these arms here are the uterine tubes, or the fallopian tubes. Now, we're going to visit the pelvic chiropractor and do some cracking. Now, your cracking should not consist of this, because that is the wrong kind of finishing move. Now, in this side profile, we are going to have the pubic symphysis. This is the front of the pelvis. So we're looking like this. And then immediately behind that, we have the bladder, where urine is stored. Above and kind of behind the bladder, we're going to have the uterus. This is the cervix. And then leading to the outside is the vagina. To be clear, during intercourse, the penis does not enter the actual uterus. The cervix prevents that. And the vagina itself is only about 4 to 6 inches in depth. Now, if you're packing more than 4 to 6 inches of manwich, that number may be confusing to you, because obviously you can put it in further than that. And that is because you have discovered that this is soft, adaptable muscular tissue, and it can accept objects that are larger than 4 to 6 inches. It has to be properly prepped, though, because otherwise you can hurt your partner, and that is the opposite of what we want to do. Now we're going to talk about periods, and this is important. Yes, to you. I want to give you some insight to what is actually happening so you can identify with your potential partners while they're going through this. Inside of the muscular part of the uterus, there is a layer called the endometrium. This is a protective and somewhat nurturing layer for an embryo to actually implant or digest itself into in the event of a fertilization event. Wrap it up before you slap it up. But if there is no fertilized embryo, this actually has to be shed off. It's actually a protective instinct and prevents cancer in the long run. What happens, though, is that this tissue, and it is relatively a thick layer, is actually cut off from its blood supply and then expelled from the body via a series of muscular cramping that is provided by the uterus. It actually squeezes all of that out, and your partner becomes your little ketchup packet for 3 to 7 days. Now, to make their lives a little more tolerable and protect them from messes, they have a variety of tools that are designed to help catch all of this mess. Now, tampons look like this, and some of them have this plastic applicator. No, the applicator does not go in there. It is just used to insert it here, and then these expand. They seal everything up, but they also catch and absorb all of that tissue and blood that is coming out of there. There are also other internal devices like menstrual discs and menstrual cups that are inserted into the vagina, and then they sit at the cervix and catch all of that tissue and blood. And then these are rinsed off, sterilized, and reused. Now, this next part is for the ride or dies, the true learners. This is your Easter egg and is going to give you a window into why the clitoris is so important to pleasure. It and the penis are what are called homologs. They are the same structure. Now imagine for a minute that your partner just left this out of the equation entirely. I'm assuming you would be a bit disappointed. And this, my friends, is why you have to learn about this and how to work it properly. And if you watch this far, I don't want you to have any excuse not to know where this is. You are always going to be able to put the zing in the bang from this point forward. So right here, different model, where is the clitoris? All right, this is going to be the visible portion. This is the arms that are sticking out, and this is the bulbs. Notice how it is placed. All of it can be stimulated. Now, go into the world and spread some joy.